Hello, let's learn about HR training. This will be hospital-wide training and development program. This program should consist of both in-house training and external training. Not only the employees but other staff should also be educated trained in their respective fields. Examples of external training include attending workshops, seminars, CME, medical awareness camps. The HR department should have a planned trained calendar and should retain all the training and evaluation records, trying to ensure that the trainings are conducted as per the calendar planning. This training calendar should be reviewed periodically and kept up to date all the time as per the changing needs of the patient care service. All the hospital employees and other staffs, including doctors, paramedics, part-time workers, ambulance, all the outside workers standing within the station within the hospital. In some hospitals, even the pharmacy service has been outside, but the station within the hospital premises. So all the staff should be included. It should cover all the growth and development requirements for the hospital staff. HR department may develop training models with the help of other sources like hospitals, clinics, and medical equipment. Identify suitably qualified and experienced trainers for conducting the trainings. Conduct mock drills, CPR, BLS, ACLS trainings, occupational safety. Identify and proper handling of hazardous materials, identification risks, and employment rights. Some training topics are specific only to certain categories of staff, but some training topics will be for all categories of staff. However, it is at the discretion of the HR head and the hospital management to decide which training should be imparted to the staff and which training should be specific for. HR department may prepare work instructions, checklists, informative leaflets on various training topics and make this available to everyone for the ready reference and guidelines. Return proper records of all the in-house trainings, retrainings, and evaluations, and return records of all trainings given by external resources. Devise a method for evaluating effectiveness of the in-house trainings given. Based on the evaluation report, you may have to conduct repeat trainings. Evaluation can be done through verbal interview, through written test, through observation during work, or any other method that you can consider appropriate. The feedback mechanism, and this feedback will enable the HR department to evaluate the training module and make changes. Try to incorporate the changes given by the trainees to improve the training module. Design a standardized feedback form. This parameter that will decide to include in the feedback should be equally relevant to all the training topics. Analyze the feedbacks based on the feedback analysis into this new relevance to the training topics, what knowledge trainee has gained, the positive aspect, negative aspect, and what the trainer is able to explain everything should be included in the feedback. HR department should develop and implement policies and procedures for addressing the health needs of the hospital staff, including the outsourced station within the hospital. Outside vendors may have their own schemes. Please note that outsourced staff also needs to be vaccinated. Catering staff to prepare food for the patients should be free from infection diseases. Any catering staff suffering from infection disease should not be allowed to prepare food or serve food into it. There are vaccination plans. Some hospitals have vaccination schedule. Mechanism for regular health checkups of different direct patient handlers. Adequate personal protective equipment should be made available. It is the HR department responsible to ensure that sufficient quantities of required outsourced are always available to the hospital. Hospitals usually provide group health insurance schemes. The vaccination schedules of the hospital staff should be maintained in the proper records. Health checkup reports and actions should be as taken should be mentioned. Department should maintain a list of all the outsourced services. Proper memorandum of understanding as MOU or contract should be maintained for each outsourced service. By preparing the MOU contract, ensure that all the legal requirements are complied with. It is the HR department responsibility to review the MOUs as per the need. The risk review should be carried out in concert with the outsourced service providers and the concerned department. All the outsourced service providers need not be under direct control of HR department, but the MOUs or the service contracts will always be maintained by the HR department. All the outsourced service providers should be made aware of the hospital standard quality requirements and able to deliver their services in conformance with the requirements of NABH and also in conformance with the hospital's own requirements. There should be proper two-way communication between the hospital and the outsourced service. And proper control over all the outsourced services is very important is for ensuring that the outsourced service providers are providing services as per the hospital standard quality requirements, as per NABH requirements, and as per legal requirements. The base method of establishing protocol control is through an interaction or a control chart, which will enable the outside provider to understand the hospital's process requirements. It is not necessary for the HR department to prepare the interaction control chart for all the outsourced service providers. The department dealing directly should be responsible for preparing the charts for those services. Preparing the charts, HR and other departments should also define the quality parameters for control the service standards. Share these parameters with the outsourced service providers and ensure they understand their requirements. For outsourced catering services, kitchen hygiene, kitchen staff periodic health checkup, Ensuring that correct diet is good for all the patients. For outsourced pharmacy services, stocking medicine as per hospital drug formulary proper segregation. Other such parameters should be. Data interaction charts with the outsourced providers so that they can become aware of the service standard and are able to take timely action on all the recommendations. Plan training and awareness sessions for our outsourced staff. The training topics will be based on the hospital requirements. Some examples of training topics include infection control practices, hand hygiene, personal protective equipment, proper labeling of food trays, washing protocols, actions to be taken in case of emergencies. We may also share the training models with the outsourced vendor, written proper records for all the training activities. If the outsourced vendor is not stationed in the hospital premises, then the HR department and other concerned departments will conduct second party audits of vendor premises. The second party audits may be scheduled half yearly or as per hospital's protocol. The vendors will be informed in advance about the audit. Please return proper records of all the second party audits, like audit findings, the actions recommended, action taken, follow up audits, and all the mutual discussion. Results of audits may also be used to assess the performance of outsourced vendor. Contract may be terminated on mutual discussion and agreement.